Good morning, Dr. Morse, injury experts. Let's talk about this knee injury for the Boston Celtics, Jaylen Brown. Now, we first started hearing about this right knee injury back in early February when the Celtics posted this tweet saying that he had right knee swelling. Now, this was a game after they played the Knicks. And after that, it continued to progress with similar comments, right knee swelling, right knee swelling. Eventually, they changed the diagnosis to right posterior impingement syndrome or something along those lines. You can see it here. Now, I don't know if this was the exact time, the first time they commented on it, but this is one of the times that I noticed it. Now, that's a very specific diagnosis. And when I saw that, I said, ooh, okay, there's only a couple things that can cause that, can, mean something that's a very specific comment. So it's not like, oh, hey, right knee swelling, patellar tendinopathy, whatever. So now we hear the other day that he's been dealing with a meniscal tear in his right knee for the past several months, likely from this initial onset in February. Now, let me break this down and kind of give you an idea of not only what he was dealing with, where the location of it is, but also what his treatment options are and how limited he was in the playoffs despite playing really well. Now, if we look at the knee has a meniscus that is this blue thing right here, that is the cushion between the upper and lower part of the knee. Now that protects the cartilage, which is the blue in this model where the meniscus is white here. So you can see as the meniscus starts to wear down, the cartilage is usually going to start to wear down as well, and you can start to see fraying of that cartilage, and that's what we call arthritis. Now, it's important to understand that the meniscus has two individual parts. So you have one on the inside and one on the outside. So if you were to look at a meniscus, it kind of looks like this, and the other half looks like that. So they basically kind of meet. The problem with the meniscus, and as you can see in this model right here, is that only the outside has red, the inside has white. This is what we call the red zone and the white zone. The red zone is the only part that has a good blood supply and heals. But most of the time, that's not where it's injured. It's usually injured in the white zone. And that usually leads to instability, pain, swelling, lack of explosiveness. Because the issue with the meniscus is that its job is to do multiple things. It is responsible for stabilizing that joint. It's responsible for indirectly stabilizing the ACL. It takes stress off that cartilage. It's also responsible for any unstable grounds, think grass, sand, anything like that, but also for twisting. So whenever you pivot and rotate, that meniscus is going to take a lot of stress. Furthermore, when you are squatting or when you go down, the stress in the knee goes up 700%, 7x. Now that's a normal knee without any injury. So an injury is going to feel a lot worse when you have a meniscal tear. Now, given the way that they describe this injury, this is a posterior horn meniscal tear. That means back, either back on the inside or back on the outside of the knee. I don't think they ever clarified where that was. Now, with that being said, the meniscus, look at how the knee, where all the pressures go when you bend your knee. When you see it square and we're stable out, just standing, all the pressures are relatively even. But when you squat or when you bend your knee, all of the stress is posterior. So when you have a posterior horn, literally when this is attaching to this bone, it's really unstable and really uncomfortable and painful when you're trying to bend your knee, which is pretty much all we do. Now think of every time he jumped, every time he loaded, every time he pivoted, every time he tried to change directions, you have to load the knee from the posterior aspect. So that's the problem with cortisone or anything like that, is that doesn't actually change anything in the knee. It just decreases the swelling and inflammation, but it's not going to magically heal that meniscus. Now, they may have tried something like PRP or a stem cell line, which would have significantly improved the environment and sometimes healed that meniscus. Sometimes it's not enough. Now, the challenging part here is understanding the importance of an anterior versus posterior meniscal tear. An anterior meniscal tear, meaning close to the kneecap, close to the front of the knee, I usually like to describe as you think of driving a four-wheel drive car and you have a flat in the front. Not the end of the world, but you have to change it. That's an anterior meniscal tear. Annoying, concerning, but not completely detrimental for most people. Now, if it's a posterior meniscal tear, a posterior horn meniscal tear, that's where all of our power comes from, because that's where the meniscus attaches to the bone. So, when you have a posterior meniscal tear, think of that as if you were driving a rear wheel muscle car, and now you have a rear wheel flat. You can't hold the car on the road to save your life, because that's where all the power is generated. You're just gonna lose all traction, and you have to change the tire immediately. That's the issue with a posterior horn tear, is that's where all the power from the knee comes when you are loading and that part of the meniscus is torn. The other thing that most people need to understand is that most of us think we walk like this, but in actuality, most of us have an inward tilt to our knees. So therefore, we're gonna have a lot more stress on that medial or inner part of that meniscus. So that's putting more stress on that knee. Now, he's still young, but he's got a lot of miles on his knee, similar to Jason Tatum. Now, what are the different options here? He admirably played probably through a decent meniscal tear. I'm gonna walk you through the different types of tears very quickly, and then we're gonna transition to what the treatment options are. Now, if we look here, there's about 5 or 6 different types of tears. The most common, not in this group, but the most common in general, would be the degenerative tear, kind of a wear and tear type thing. Now, you can have a longitudinal tear, which is going north to south. You can have a horizontal tear, which is kind of going this way. You can even have a radial tear, which is pretty common, that is cutting across this way. And then you have the more concerning ones. You have a flap tear, which is an actual piece of the meniscus hanging loose. Sometimes that can break free. And then you have this large chunk of meniscus floating in the knee, causing it to lock and jam, almost like a rock in your shoe. The final and worst type of meniscal tear is a bucket handle, where you can see it actually is popped off and no longer stable. When that happens, you can't move your knee. It's locked, it's unstable. Sometimes we see these in ACL tears combined, and that usually requires surgical repairing immediately, same day, because the knee's not stable any other way. So, hard to tell exactly which type it was, but it probably wasn't a bucket handle or a significant flap tear, because he wouldn't have been able to play over the past several months, regardless of how much stuff they put into his knee. So he admirably played through the playoffs. Unfortunately, they did not make it to the championships to repeat like they probably had wished. And now we hear more information about his knee injury. So what are we talking about here? What are his different treatment options? Well, at the minimum, he's going to shut it down for a little bit. But now they have to figure out what to do with that unstable meniscus. You have basically 2 options. You have conservative mixed with PRP or a stem cell line, or you have conservative without any of those, or you have surgery. Now, surgery has 2 options. You can have a trimming and you can have a meniscal repair. Now, trimming is something they don't traditionally like to do a whole lot anymore, because it's removing a lot of the meniscus, and the problem is you can't replace it. It doesn't magically grow back. And now, especially the posterior horn tear, you can't, that's where all the energy and the stabilizations, you're not going to remove that, because his knee will never be the same. So they pretty much have to repair this if it's significant enough in the posterior horn. The issue with repairs is they actually have to literally sew that meniscus back together, and sometimes tack it to the bone as well, depending on if it's unstable or not. Now that is a significant injury and a significant recovery. A traditional scope with a meniscectomy is usually a couple weeks, maybe a little bit more, a month, 2, not a big deal. But when you're talking about a meniscus repair, that's usually 6 to 12 months. Because if you return too quickly, you're going to tear those sutures and you have to go back to the operating room and start all over again. Now, you can take a conservative approach with either PRP, probably not strong enough here, or a stem cell line. This is personally what I do, but a posterior horn meniscal tear in a high-level pro athlete still in his 20s is very, very hard to do. Even with the best products money can buy, very, very difficult. You actually have to walk the needle into the meniscal femoral, which is where the ligaments attach to the bone, medial, lateral. You have to walk it along the MCL. You should walk it laterally as well, doing the same thing, taking a significant approach. And you have to use a lot of product, a lot of volume, and usually you have to do it multiple times because this is a very stubborn area. But if you want to keep that meniscus intact and not remove any, that's not a bad idea. We don't know what he's going to do. We don't know which approach he's going to take. But I will warn you that if there is a significant piece of that meniscus removed, he will never be the same player. I will describe one player that this likely happened to, and he's never been the same player. Joel Embiid. Completely different position, completely different body type, but reportedly had a significant meniscus injury, removed a bunch of that. I believe Lonzo Ball probably had a similar injury as well. These are bad injuries. So hopefully that was helpful. This is an unfortunate injury, very admirable. He pushed through for 2-3 months on this, probably getting rehab every day and taking time off as he could. He was probably playing at 60 to 70% at the end of the season at best, and his knee was probably causing pain with most steps, especially any pivots, anything that's uncomfortable, sometimes sending what I call lightning bolts down to your foot. These are very uncomfortable, very challenging to walk, to jump, to twist, to do anything. I'm Dr. Jesse Morse. I hope that was helpful. If you have any questions, please feel free to leave them below. You can follow me on Twitter at Dr. Jesse Morse, as well as on Instagram and the other social media platforms. Thank you very much.